So sometimes having a multi-layer compression bandaging is helpful in decreasing the size of the limb. We have an example here, and when you look at this, there are several different layers. The first one is just a cotton sleeve that protects the skin. The second one is a foam, and we can see just up at the very top a little bit of this white foam. Here's another example that is a little bit thicker, so there would be some choices that the physical therapist could make. And then you see this beige bandage, which is a short stretch bandage that doesn't have very much elasticity, and that's part of the key. That is in contrast to a regular ACE wrap. So here is a regular ACE wrap with all of its stretchability. That's occasionally used, but much more often it is helpful to have a special kind, a short stretch. So we have several layers there, and then in some cases the fingers or the toes also need to be wrapped and compressed. The purpose of the multi-layer compression wrap is to encourage the swelling to go down, to help you be smaller. In therapy, in active treatment, it is worn 23 hours a day. The 1 hour that you don't have this wrap on is the hour that you would have the second treatment, manual lymphatic drainage. Now, I mentioned that occupational therapists and physical therapists sometimes treat lymphedema. They do require special training, so you want to make sure that you have a trained, certified manual lymphatic drainage therapist. A few massage therapists have learned these techniques, but they usually work with some of the other therapists, and certainly under the doctor's guidance in all circumstances. The massage, manual lymphatic drainage, is a very gentle massage that slides the skin. It's done on the skin throughout the arm and the entire chest in order to wake up the lymphatics and encourage the lymph nodes to activate and try to move the lymph over to the opposite side where the lymph nodes are working well so that it can be picked up. It's very relaxing. Many of my patients fall asleep. It doesn't hurt, and it's rhythmical, takes somewhere between 30 and 60 minutes depending on how much swelling you have and whether it is involving a very large area. Sometimes swelling gets into the trunk and it has to really be worked throughout this area as well. This can be learned. The patient can learn how to do it on their own. And that's really the hallmark, those two pieces, the manual lymphatic drainage and the multi-layer compression bandaging. Now, once the limb gets to be as small as it's going to get, then you would be fit with a compression garment. And I've mentioned these several times. Here is a thigh-high stocking. So the heel, you can see right here, and this would go up to the thigh. And certainly doesn't look like it's long enough, but it has a lot of stretchability to it. It's quite snug and tight, and it's a little bit challenging to put on. But that is important in order to maintain the compression that's going to keep that fluid out of your arm, or in this case, the leg. There also is a version for the arm. So this is the portion that would be up at the top of your arm, and then this would be at the wrist. And then the hand portion. It isn't always necessary to have the hand, but that would go on and provide compression in that area. Sometimes the hand goes down all the way into the fingers, so that would provide compression into the hand. The multi-layer compression bandaging gets you smaller. The pressure garment, or compression garment, keeps you smaller. And many people kind of work between the two of them. They have some circumstances where they wear the garment and some circumstances where they wrap themselves. While you're in the compression, whether it's the bandages or the compression garment, doing certain exercises can be helpful. Now, there's lots of different kinds of exercises, and many of them are helpful for people who are trying to recover from an event. after you've been through treatment, maybe a surgery or maybe some chemotherapy or radiation, oftentimes people are fatigued and weakened. So doing general exercise, general strengthening, and general aerobics can help combat that fatigue. Also, in cases where there's been a surgery, sometimes the motion is difficult. It's hard to get your arm all the way up because it's constricted here. So range of motion exercises might be helpful. But what I'm speaking about is specifically exercises to alternately pump the muscles so that you move fluid. So special kind of exercises to help move the fluid up out of the leg or out of the arm while you have your compression on. We have talked about a lot of educational pieces, skin care and avoiding casual injury. All of those are important in your treatment and your care. There's one more piece that some physical therapists use, and that is a pneumatic pump. Now, some therapists choose not to, and that's perfectly fine. There are some good pumps out there, and there are some that aren't so good. If your therapist has recommended this, it would enhance the manual lymphatic drainage that you might be doing at home. So there are several different choices. In cases where it is a very severe swelling, I might have a patient come into the office for 1 or 2 hours every single day for up to 14 days. And that is quite a commitment, but it's very important in maximizing the success of getting it smaller. I have some patients that I see 3 days in a row, and then they go on their own for a day or two and come back and gradually take over themselves. So it very much is dependent on the status and the patient themselves. The physical therapist or occupational therapist would make those choices about what to do and how long and when to do it. But ultimately, you are responsible for taking over your care and learning how to manage things. Paying attention to what increases your swelling and what decreases your swelling, and knowing what things out of that toolbox to use at what point. So what I hope today is that we would go over, firstly, what is the lymphatic system and how could lymphedema occur? Secondly, what are the precautions that might help you avoid lymphedema? And then thirdly, what might be offered if you had the condition and were going into treatment? It would be important to stay in touch with your physical therapist and your doctor about these things. Do you guys have any questions? Very good. Well, make sure you keep in touch with Gilda's Club, and if you need more information about physical therapy treatment, you can check my website, www.bethshelley.com. That's BETHSHELLY.com, and go to the For Patients page. Thanks a lot for listening. Good luck.